Hi, and welcome to the Director of Surgical Services Recruitment Toolkit. This is part 3 of a 7-part series helping the beleaguered talent acquisition professional accomplish the most difficult search within the hospital. In part 1, you'll recall we discussed a quick start guide. In part 2, we started you along the way of setting up a search so that you could do it yourself. Today is part 3, finding the right Director of Surgical Services. We'll look at the desirable traits and metrics for a Director of Surgical Services, what to look for in a resume, and I'll introduce the concept of deal breakers. In other words, how to know the candidate you think may be a pursue is actually a pass. Let's start with the resume. You may recall from the Quick Start Guide that 86% of Directors of Surgical Services have a BSN. This is close to a must-have, especially for magnet hospitals and hospitals on the magnet journey. Yes, there are workarounds. You can reclassify your director as a consultant or reorganize and reclassify, but in my opinion, it's just better to make that a requirement, especially for the magnet hospital. The CNOR certification on a resume is a good indicator of clinical expertise. In Chapter 1, we discussed the CSSM is better. CSSM stands for Certified Surgical Services Manager. But how to screen for clinical skills? Look for the candidate that started as an OR nurse, primarily in the hospital operating room. Secondary would be the nurse from a surgery center. It is less ideal to find the candidate who has come up through the post-anesthesia care unit. They will have difficulty with the lead by example requirements of the operating room. Should you require a master's degree? That's a tough one. The statistics say 78% yes, they have a master's. But if you'll recall from the last installment, we want to have 17 candidates in play at various stages at all times. So the answer is actually no. That should not be a requirement. Instead, phrase the master's degree as something the director should get within 3 years, which will signal the up-and-coming Director of Surgical Services candidate that you are engaged in their professional development. Now, there are metrics that are tied to the successful management of the operating room. Here they are. On-time starts for OR cases each morning. Look for 80% or above. Case cancellations. You want your Director of Surgical Services to improve the numbers wherever he or she came from. 3% and below is the ideal. Turnaround times. This is where you finish one case and get ready for the next. Those should be 30 minutes or less. How to measure the volume of cases. While this is less strictly in the control of your Director of Surgical Services candidate, the rule of thumb is 500 cases per OR per year. So if your candidate comes from a 10 OR suite hospital, if they have more than 5,000 cases per year, they come from a busy OR. Look for Joint Commission accreditation experience if you're a hospital, or AAA HC if you're a surgery center. Did they get their previous employer through survey? What were the findings? Now let's turn to the deal breakers. First, and this is again related to the resume, the word surgical appears in 2 areas unrelated to the operating room: medical surgical or med-surg, and the surgical floor. Neither of these are good training grounds for a Director of Surgical Services. There are also candidates that look great, but in reality aren't worth the bother. Use the mnemonic device, house, spouse, kids, to trial close early and often. If a candidate has children who are sophomores in high school, take the assumptive stance that they are about to make varsity or the lead in the school play. That mom or dad isn't going to relocate. And don't buy into the false promise that mom or dad is going to live away from the family and maintain 2 households. Yikes. Ask about the house. If the candidate owns their own home, dig a little deeper. Can they rent the home out? This sounds daunting, but is overcomable if you break the cross-country move into bite-sized chunks. If you're unsure how to broach the conversation about these family and home-related issues, start with, do we need to find a job for anyone else in your household? The candidate will open up and tell you what you want to know. Lastly, and this is the most important thing to know, should I look for passive candidates who are working successfully at another hospital, or active candidates who are easier to recruit? Answer, both. So that wraps up today's chapter of the Director of Surgical Services Recruitment Toolkit. Look in the show notes for a link to the one-pager that will flesh out these concepts more. Tune in next for Part 4, Secret Life of Search Firms. Good luck and keep up the great work.